Welcome to the East Long Meadow Board of Health. I'd like to call the meeting to order. The board is recording. Is anyone else recording? Okay, I'll take that as a negative. And so here we go. I don't have any announcements, I don't think. So Amy,
Well, I think you do have an announcement. You wanted to discuss reorg now that we have a full board.
Oh, you wanted to do that now. Okay.
Well, this would be the chair. Yeah, so as the chair.
That's fine. That's fine. So I was just wondering, I know, Sarah, you're just going to be so delighted with this request. But
Good
you know, you know what I'm going to say. And I don't, you know, I'm just going to say I would rather not be the chair just because of my work. So for a couple of reasons. One, I'm completely overwhelmed, but two, there are times when I have to recuse because of my job. So it'd be really hard to do that when you're the chair as well. So I was kind of hoping we could swap things around. So I'm not sure what the rules of order are. You want me to make a motion or do we need to talk about it?
Well, why don't we make a motion to have a reorg? We'll get a second and then we'll discuss. And then
all right. So I do make a motion to reorganize our roles here on the Board of Health.
All right, I'll second that for you.
Thank you.
And now we would discuss.
And we're okay. Oh, that's right. So sorry. It's been a long day. I've been on this thing all day, losing my mind.
I hear you. I hear you. And it's wonderful to see you again.
It is. I missed you.
I miss you too. And I really appreciate the support from everybody here. Donna, it was wonderful to see you, and Alex.
You too.
They didn't help me any because they made it hard, but they made it hard because I really appreciate working with everybody. So really grateful to be back. Christine, it's really very nice to meet you. So I'm looking forward to getting to know you some more. In terms of the reorg, I feel the same way as you, Karen. I'm completely overwhelmed with the work. But I do not necessarily know of any instances where I would have to sort of recuse myself. I don't think in the last few years, Amy, that has come across in any situation. So we're a team. So if we can, oh my goodness, if I say yes, Christine, what are your thoughts? Because I would really love that.
So I am also really overwhelmed with work, and I am also very brand new at this. This is my second meeting in its entirety. I would love a little bit more experience before I have to step into that role.
No, that's understandable. I think I would feel exactly the same way. So if Karen and Christine, if you're comfortable with me getting back into that position, I will lean on both of you though, as a team. And I think that's how we worked before. Karen, Christine, as you've learned, is a powerhouse in not only locally, but statewide. And her expertise is extremely important to any work we've been able to get on there. So I am the chair. I would be the chair in name, but it's a team effort. And I also continue to lean on our team in the health department in Amy's leadership, and Donna and Alex. So they're extremely important in us sort of thinking through things together. And that's no worries at all, Donna. So I think with that, that's in other words, with that, I would be more than happy to be able to step into that position as part of our team. Karen, it's only because I love you. And Amy,
I love you
and
too.
Donna, and Alex, and Christine.
Even more now. So, so do we need to make another motion for the roles, Amy? Okay, so what I'm proposing, or I'm making a motion that Sarah McAdoo take over as the chair. I will slide back into my vice chair role. And Christine, by default, that makes you our secretary.
Sure.
And so that is my motion.
All right, and I will second that motion.
All right, all in favor?
Aye.
Aye.
Woohoo! Okay. But I'm there for you, girl. I'm there for you, you know.
And I think that's the way that we've been working, and I so much appreciate it. So you are facilitating this meeting. I will jump in with Amy to facilitate the next one, to lead the next one.
Yep,
Thank you.
yep. And as you know, we don't often do very much facilitate. Well, maybe we do. We do a little facilitating, but I always lean on my friend Amy, who is so gifted in so many ways, to help lead me. I'm trying to change my view. Let me come out of full screen so I
can tell
see my
you. I can tell
agenda.
you. The next item is approving the minutes from last meeting.
Okay. So has everyone had a chance to review the minutes that were sent in the packet? I did, and you did, Christine, and
Yes.
I'm pretty sure we were the only ones that were
Yeah.
there. So I think in this case, can I still make the motion to approve them, Amy, or does Christine need to?
Christine can do it, and then you could second out of necessity.
Yep.
Okay. All right, so I will make the motion to approve the minutes as written from the last meeting.
And out of necessity, I will second that motion. And I think we both agree.
Agree.
And then Sarah will officially abstain.
Yeah.
Thank you.
So Christine, and as usually the secretary signs and dates the meeting minutes.
Okay.
Since we are remote, would you prefer to send a note that just says, I, the Secretary of the Board of Health, approve the minutes for this date with a motion of 3-0? Or do you want us to send you the finalized minutes with the roll call vote, and you scan it back to us?
Either one works. It's fine. I can send you something. That's totally fine.
Okay, so actually, Alex, will you draft that up for her? And then Christine, that way you don't have to worry about drafting it, making it official, and meeting all the criteria. So Alex will send it to you, and then you can just send it back.
Perfect. Thank you, Amy and Alex.
Great. Karen, the next item on the agenda is public comments.
Yep.
We do have 2 attendees.
Okay.
So if the attendees want to raise their hand if they would like to make a public comment, and then Jamie can let you in.
Looks like I don't see any hands.
Okay. Then they are the next item on our agenda. So if you want to go ahead and bring them in. The next item up is a certificate of appreciation for 2 of our MRC volunteers. So when they get in here, we'll. All right. Do you guys want to turn on your camera? Hi.
Yeah, I'm trying to figure out what I missed here.
There is on the bottom left, there is a start video button.
Perfect. Very good.
There.
Hey guys. Look, it's our vaccination team in full effect.
Hi, Amy.
Hi,
How you doing?
guys.
I'm not
Good.
sure. I'm not sure I recognize you guys without your masks, but
I miss you guys.
Oh, yes,
That's
no, it's so funny.
That's true.
And Olin got a haircut.
you certainly did.
All right. So thank you guys for coming tonight. The board really wanted to have you guys here to show their appreciation for some of the work you've done. for us. And Donna's going to go ahead and help lay that out for them.
All right. So just a quick overview of what MRC is. MRC is it's the Medical Reserve Corps, and don't let the name fool you. You don't have to have any sort of medical background to be part of it. It's a national network of volunteers organized locally to improve the health and safety of our community. The MRC network comprises approximately about 200,000 volunteers in roughly 800 community-based units located throughout the United States and its territories. MRC volunteers include medical and public health professionals, as well as other community members without healthcare backgrounds. MRC units engage these volunteers to strengthen public health, improve emergency response capabilities, and build community resiliency. They prepare and respond for natural disasters such as wildfires, hurricanes, tornadoes, blizzards, and floods, as well as other emergencies affecting public health, most recently COVID-19, such as disease outbreaks. They frequently contribute to community health activities that promote healthy habits, which include things like emergency preparedness and response, emergency sheltering, disaster, medical and non-medical support, first aid during large public gatherings, community events, support, vaccination clinics, and mass dispensing efforts. Tonight we have a couple introductions for you. We have Olin Johnston. Raise your hand, Olin, so they know what you got. I know they can see your name. And Phil Chapman. These are two of our top volunteers with the MRC unit. And I just wanted to give you a little introduction on both of them. Olin has been with our unit since March 8th of 2019. His background is in law enforcement, and he was also an EMT and paramedic. And he manages the COVID-19 safety operations for the First Congregational Church in town. In April 2020, this Council on Aging called on the East Longmeadow MRC to assist with Meals on Wheels deliveries. Olin answered that call and stepped right up and is still today assisting the COA with those deliveries. So it's been a full year and he's still going strong there. They won't give me back. They won't give them back to me. In May of 2020, the East Longmeadow Clerk's Office asked for volunteers to help at their voting polls and also to help with mail-in ballots and sorting. And Olin again stepped out and volunteered for both of those positions. And the clerk immediately responded afterwards with appreciation to his extreme professionalism and his work ethic. Again, they wanted to keep him for everything they do moving forward. So I got to fight here. Olin volunteered for both. In February 2021, we were called to assist the town with its vaccine clinics, and Olin assisted at actually 26 of those clinics with registrations, check-ins, check-outs, setups, and breakdowns. He's also volunteered at past health department flu clinics with crowd control, and everybody loves him. So it's a little more than control. He's he just eases people. So they love seeing his face and they know who he is. So Phil has been with us, the East Longmeadow MRC and CERT since 11/23 of 2018, and he's a past East Longmeadow firefighter. In February of 2021, Phil volunteered to assist the MRC with registrations over the phone, which is not an easy thing to register the 75 plus residents to get their vaccines. He also volunteered at 22 of our clinics with registrations, check-ins, check-outs, setups, and breakdowns. In the past, Phil he's also been active in public outreach with us and recruitment at our booths. He's done shelter exercises with us, flu clinics, delivery of emergency go bags to our town seniors. And he's always eager to volunteer and steps up to any opportunity in a variety of settings. And his enthusiasm is so inspiring. He's really excited to do this kind of stuff. So it's a lot of fun to be with him.
A great group.
Both are so dedicated and talented volunteers, and we're extremely appreciative of their contributions to our community.
Yeah, I'll just add one thing about each of them. Olin comes to us with also a background in emergency preparedness, so he's been also offered good feedback for us in terms of some of our flow and some design improvements that we could make throughout the course of the vaccination efforts that have improved our residents' process with the vaccination. So that was instrumental. And Phil really, during the senior portions, registering. They were all coming in, not sure about when their next appointment was going to make. One of the first questions we got as we were trying to register them is, when am I going to get my second vaccine? And Phil was one of the 3 people who were just on the other side of the door who would help them set up that appointment before they even left the senior center. And as far as I know, we were one of the first communities to start registering our people who were coming in for vaccines at the first vaccination effort. And I think that just speaks to us having some great volunteers to help in that, and the forethought of like all the collaboration between the fire department, the COA, and the health department in this. So that was my piece to add.
And I just want to hello, both of you. I'm Karen Robitaille. I'm currently the chair, but not much longer, of the East Long Meadow Board of Health. But I've been a member of it since its inception as its own body, separate from the town council or the select board as it used to be. And I just want to say thank you so much. And you can see the result of your efforts in the data. So if you look at the data now around hospitalization and death and new cases, the over 75 crowd is at historically low, very, very low numbers. And the 65 and over crowd has also shrunk dramatically. Our hospitalizations and deaths are way down to the levels of last summer. And this is all such great news. And we know that it's because of the vaccination effort.
And I know that I'm just coming on today and hearing all this great news. Olin and Philip, it's very nice to meet you via Zoom. And I'm blown away by everything that Donna shared. And can't even begin to express as a resident in the community how grateful the work that you're doing during this time of crisis. And it sounds like so many other times. So thank you for doing that. And definitely would love to continue, as Donna said, to work with you, as we move other efforts forward, whether it's related to COVID or other volunteer opportunities to engage other community members as well. So thank you again for your work as well.
Appreciate that.
Philip, it's really nice to meet you on Zoom. Ola, nice to see you. And just thank you both for everything that you've done.
So sorry about that. Got a little tickle in my throat, but I do want to thank you so much on behalf of the board. And I want to let you know that you're going to be getting certificates of appreciation from our town manager. Oh, there they are. They're very pretty. And gift certificates purchased with grant money from the National Association of County and City Health Officials.
Wow. Well, thank
And
you.
that grant money is to support MRC volunteer readiness. And yes, I mean, good work deserves appreciation and reward. And we couldn't have done this without you. I know that for a fact. And the people of East Long Meadow really do owe a great debt to your work. So thank you again.
Thank
you
you
very much.
We certainly miss you. I have to say, it's a great team, and seeing the Council of Aging and the health department and the fire department working together so well, it was just a great experience.
Good. We're glad. And it's too bad that the vaccine stopped coming, because I think we had a good thing going. And maybe someday the vaccines will start flowing again, and you guys will be the second people we call.
It may happen. It might happen.
Good. We'll have other opportunities with other things too.
Oh, yeah.
Oh, yes, I'm sure. That's great. Thank you very much.
Thank you.
All right.
Thanks, guys.
Donna will coordinate getting those things to you.
Awesome.
Thanks,
Thank
guys.
you.
Excellent.
Thanks,
Thank you
guys.
very much again.
Thanks for coming.
Thank you very much.
So I don't know, Karen, if you have your agenda, but now we're on to the farmer's market permit. You're on mute.
Okay. So the next item on the agenda is an application for the farmer's market. So I'm assuming you're going to tell us more about that.
Yeah, I'll jump in. So the farmers market permit isn't a permit that we have approved in the past, just because it hasn't come up. The town hasn't had a standard farmers market for us to even need something like this for. Typically, events like this are permitted through a temporary event, but per the food code, that's defined as 14 consecutive days of service. So what some communities do is create a specific permit for this type of event. And you see in your packet the application that Alex and I have pulled together. I set the fee for this permit at $75. A traditional one-day permit is temporary permit is $45 a day. So this is remarkably discounted. And anybody who is at the farmers market selling unadulterated farm goods is free. There is no charge for them to participate. We want to bring our farmers to the table. We want to encourage healthy foods and fruits and vegetables for our residents and surrounding communities. So those are, we still ask them to fill out the permit. That way, if there were ever to be some concerns that we would need to reach out to them and or know what they produced, we would have record of that. But there's no fee for them. The $75 fee goes to the participants who are selling baked pies or jellies and jams, or I don't know, what else have we had people apply for? Even pickles, maple syrup, honey. Yeah, great. Thanks, Alex. So those types of processed food, which require more work on our end, really, because we have to make sure they're coming from an approved source, that they're inspected at that end, that the facility is approved, and then Donna also has to go to do the inspection. So that's some of the things that the $75 fee covers. That fee is good for the entire market season, so the spring, summer, and fall. If there is a food truck that's coming, so say there's a hot dog vendor that wants to come every Friday to set up, they will be charged for the food truck price, not the farmer's market price, and not the temporary. They'll be charged the food truck price.
Got it.
Any questions?
So do we have one that's going to be set up in town?
Yes.
Like, and where and when? This is
Farmers
huge.
Market Fridays at the COA.
Yay!
Does anybody know the start date? Soon.
Sometime in May.
Yeah.
Yeah, it's in May. The first one is the second week of May, and I think they're actually holding them at Center Field.
Oh, that's right. You're right. They moved it. Sorry.
Oh, right in center field. That's brilliant. I can walk there.
Yes.
All
But I think it is a
right.
later in the day type thought. They're trying to make it an event for people to go to on Fridays. So
On Fridays. Okay.
Amy,
Awesome.
are there any anything different that we have to do during this time of COVID for the farmers market?
there was, and that was removed today.
Yep.
Okay.
Yep.
So we are good there. We would still work through with so one of the interesting things about COVID enforcement is that some things fall under multiple industry standards. So we would still work with any of the vendors to follow the food industry standards in the time of COVID. But some of the other things that farmers markets had to comply with last year are no longer needed.
Okay. And then I think
Is there any different permitting required for, and this is again me being new, required for sales of things that are not food? So somebody wants to do like wool products or something that is that covered under the permit? Is that a separate permit that they would need for like creative?
We don't get involved in anything that's not kind of under our jurisdiction of food. They do need a permit, or they do need to file an application to participate with the rec department. So there's an application process and an approval process, but it's nothing that involves us, thankfully.
Great, just double checking.
Yeah.
Well, that is great. I'm excited for a farmer's market right in town. That's awesome.
My only question to Amy was related to inspections. In other words, just asking in terms of what the frequency would be related to that. And when I was thinking the same thing too, Karen, in other words, how many are already interested? Because that would be exciting to see that. But what does that mean in terms of our team,
Workload. Yep.
doing inspections? And I know that you were thinking about what the frequency is for that.
Yeah, and I think as the event gets bigger, it will draw in more vendors, right? Like we've seen that in surrounding communities. As the event becomes more popular, people are more likely to come and to participate. So, some of the things that are at the beginning may not require as frequent inspections as things that may come, like cheeses and farm fresh eggs and meat products. I mean, we have seen, I'm sure we've all been to farmers markets that have evolved into really complex food processes. One of the things that have recently been discussed and I think turned down by the rec department is alcohol sales.
Excellent.
They would require a permit from us. The rec director and I had a conversation kind of about if that would be a good addition to a farmer's market, and she had decided no. We did get an application today, or some interest today, from a local brewery who was interested in participating. So that might be something that comes next.
Sorry, I haven't gone to a tremendous number of farmers market, but is there usually, I'm just thinking about health. So I'm thinking about health, sorry. So it just, I understand it for other events, but that one just seems not to kind of vibe with the overall goal. And I think, another sort of question I had, I know you do a lot of education on our local cable channel. With the start of a farmer's market, is there information already that has been put out there, or could be, not to add any more of things for you to do, but, or maybe through our social media about healthy food, healthy choices, so that people can kind of, get the education with the actual event. So maybe when there's an announcement that goes out related to the farmers market, maybe some kind of just information that either gets sent out. And then in the future, if you're doing some segments for the, what is it again, the LCAT? I'm going to say it wrong.
LCAT.
That in the future, there might be something related to sort of the farmers market and what good stuff that people can find. And also because sometimes people may not, I don't know everything they're going to bring, but if it turns out that there's certain food that tends to be a little bit more consistent with certain seasons, it'd be nice to send out a few little recipes. So it would be something low key that maybe you could just do through social media that helps people just think about capitalizing on the opportunity of going to the farmers market.
Yeah,
that's great. Mass in Motion grant application thing too. I'm just saying, I know, but I was reading the master plan and there's a lot of sidewalk stuff going on, and this is all right up safe roads, safe routes to school, Mass in Motion, all that grant funding is out there. I know. And I can't write them, so sorry.
Is that separate from the farmers market? Is that like another conversation, or is Mass in Motion do something specifically with farmers markets?
Oh no, I just, in the past, the grant applications I've been a part of, the farmers market and a lot of what Sarah's talking about, like providing recipes and kind of building on the farmers market, was integrated into a Mass in Motion grant. So the Mass in Motion grant could pay for someone to do those recipes and cooking demos and stuff like that. Yeah. It's just something.
Send it to me.
Sure. I mean, I think the market needs to get up and running and see how it goes. I had a couple of questions just about logistics, and I'm hopeful that our farmers market is going to take EBT like the rest of the farmers markets. Or do you know?
That was also my question, was hoping that we would accept SNAP benefits.
I was not involved in the planning of the specific farmers markets other than the food piece, but I can check with the rec department about that.
To me, that's really important, and it's a real equity issue. And I'm wondering if this is the time maybe to approach PVTA to get the dang bus to come up to the center, because we have people coming in to our grocery stores because they have more fresh fruits and vegetables than some other grocery stores in food deserts very close to us. And this would be a great opportunity for people to be able to hop up a little bit further and go to the farmers market, but there needs to be a way for them to get there. And the fact that the bus doesn't come up to the center has irked me for my whole entire adult life. So
How would we do something like that?
I think it might be a request that comes from the town. I can do a little more research and find out for them to add a stop. I mean, it's not a simple process. It probably would involve changing several routes around. I mean, it's not a small thing, but if we now have this kind of economic center in the town, located in the center, but nobody can get to it. We do have the Rockies, we have a few restaurants. Now, if we have a farmer's market as well, it just creates a real opportunity for people to increase access for people.
And Karen, as you said before, these are things that you're thinking over time, right? So, like you said, once it gets started and we kind of see all these other things that I think we're sharing are things for us to kind of think about.
Yep.
And then
But it goes into that master plan too, as far as, transportation was part of it. And we have a bus route that comes to this far end of the town and this far end of the town. And there's nothing to triangulate that people can get to from other parts of the town. So it's a big issue, and it is an equity issue. I feel strongly about it, but we don't need to figure that all out now. I would, however, really like to know if the farmers market is going to take EBT, SNAP benefits, WIC, whatever it can take.
Okay. I texted the director to see if I can get you an answer while we're on this meeting. If
Great.
they are not, who would I direct them to include that?
Do you know that offhand, Christine? I can certainly find out.
I don't know, but that was the one question I had for
Yep.
equity and access to healthy foods for our entire population.
Yep. So if we're not, then I can definitely find out easily enough. You know Ben, right?
Yeah.
Ben's the man. You can ask Ben. You can ask him about Mass in Motion too.
All right. Me and Mr. Wood are going to get reacquainted.
Karen, how often is that grant available? Is that something they put out, annually or every so many years? Because I've been hearing.
I don't recall, and I feel like it's something I should know, and I just don't, because there's too much in there.
No worries at all. I was just curious in case, because
I think they do several different levels, so it is very possible that there's an annual opportunity, but again, I can find that out. It's all Googleable. I made that up. Googleable.
It's a verb.
Yes. No, is it a verb? I think
it?
it's an adverb, technically.
Oh, yeah?
Yeah, I think so.
Googleable.
I mean, it's been a long time since high school English, but anywho.
All
right.
So if you guys like the application or have any adjustments that you'd like to see on there?
I like it. Do we need to approve it?
Yeah, so I would ask to approve both the application and the fee.
Okay, so I make a motion to approve the farmer's market permit application and the associated fee.
I will second that motion.
All right, all in favor?
Okay. And the director of rec let me know that they've talked about it. They're not sure where they are in the process. So I let her know that it's a priority of the board, and I will help out in any way I can. So I will make sure that continues to make progress if it's not.
Yeah, and just let me know if you need help.
Okay.
All right, and now we're on to an adjustment to the food service permit application.
So one of the things that we have not had in town that the planning board has now started to recently accept applications for is residential kitchen permits. So, or what do they call them? Cottage. There's a new, I think, definition for them, cottage industry. But basically, the food code allows people to cook non-potentially hazardous items or non-PHF, so nothing that needs to be refrigerated, or so, you know, like no quiche, but you can make cupcakes. Planning board has previously not allowed, would not approve, what do they call them? Like give approval for these types of events, even though we have said we would. They have changed that decision, and they have approved someone to do a baked goods business out of their home. And so now we need to adjust our permit to include that as an option. So you will see it is added. Where's it added, Alex?
On the third page or second page.
Residential permit. There you go. Second page, 3 down. And we gave it a flat fee, the same as the lowest that people pay for any other food service application. One thing that I think we'll see, as these get more popular, we'll see requests for variances from the grease trap ordinance. So the one that's been approved now has already submitted a variance. She wasn't ready to move forward for this meeting, but I imagine that we will see her at the next meeting.
Okay, that seems straightforward enough. I've seen the postings from, I think, that company on the town forum. So, and I think during COVID, there's probably been quite a growth in these kinds of industries, and I can understand the town wanting to support that. So I'm just gonna go ahead and make a motion to approve the amendment to our food service permit with the associated fee.
I second that motion.
Any discussion? All right, all in favor? All right, thank you.
Great.
All right, and next is, the annual report.
Yeah, so I included the annual report for you guys because it recently got published. It was due, I think, in like February or March, where things were really crazy. So, and we weren't really meeting very often, so there was no review process for you guys. So I wanted you to see what was out there. It does look different than it has in the years past because, well, we've been dealing with a pandemic, and Donna's preventative inspections have really fallen off from where we had been in previous years. So we tried to show where her work was going, to continue to kind of validate the work that was being done, but it's just the efforts are being placed in a different area. So we included the COVID calls that we were tracking, and some of Alex's work too, because Alex was the one responding to a lot of the calls. I mean, our call volume, I don't know if you see in January, we got 229 calls, only COVID related. So, I mean, we were dealing with hundreds of calls, you know, as you average it out a month, which then led to, you know, you can then equate those over to Donna's inspection of those, right? So people would call and complain or ask a question. It would lead to Donna responding or supporting, you know, I have a COVID case in my community, what do I do? One of us would then respond to that. So that took up, you know, rightfully so, I think most of our time this year. But I did show that, you know, when Donna went out to do an inspection of a restaurant, she would do an operational inspection at that same time. She would try to double up wherever it made sense to. So I also would expect that the change in our reporting statistics would look the same for next year. So in addition to sharing what we have this year, it's also kind of a preemptive notification that we're going to see similar numbers next year before we can really start to get back on track with you know, the process that we had, the SOPs, the pre-operational, the preventative, all the things we were doing before, and our community events. I mean, our community events, we were hosting so many. This year, Rec took over our community trash pickup day. We just didn't have the capacity. So I'm glad it was done. But usually that's something that.
And it looked great too. There were a lot of people out there.
Good. That's great. So we're glad that someone's picking those up. You know, our bike rodeo was a huge, had huge attendance numbers, and it was just starting to really pick up. The National Night Out for the police that we do in August. So there were a lot of events that usually we would report, share pictures of, that aren't included in here because they just didn't happen. But one of the things that I think is really, I'm really proud of in this report is the flu clinic data. So even in the pandemic, while things were really tricky with what we were allowed to and not allowed to do, we were able to hold a successful flu clinic. We went up like 250 flu vaccines this year. And I think that is mostly in part to the fact that we were doing it in a drive-through fashion. It was a very different clinic. It allowed us to push through many more people and support our community's vaccination efforts in a much more efficient way. So I look forward to continuing doing it this way as we move forward, because it was much more successful. We had only positive feedback from the community on this. There was no wait. Like in past, we've had like a 20-minute wait while they were, when the clinic opens, everyone wants to be there right when they open. We had no wait. It was all done by registration. So I think we learned a lot. COVID, has some great unintended consequences. And I think for us, the way we perform our flu clinics will benefit from that. So. Unless there are any questions on the annual report or items that we completed or ways that we reported it.
I didn't have any. I'll be honest. I skimmed that. I was trying to skim that and also skim the master plan, which was fascinating. So I think I probably spent more time on that. Sorry, but it looked great, Amy, as usual.
You know what we're doing.
Yes, I do.
I'm trying to figure out where I can put myself without this glare, but Christine or Sarah? No?
I haven't finished completely skimming it, but there was one thing I was curious. There's a lot of information here, which is not surprising. I've always been doing a whole lot of work. So even through the pandemic, I was curious in terms of the trash and recycling, when those trash cans were given out, how much that had an impact in what we were collecting. So the detail might be in here, but I was just curious. You don't have to give me numbers, but more or less if it had helped to reduce, sort of some of that overflow that people would put in some of that, which would have reduced the cost of keeping that up. I was just curious.
So there's two pieces to that. One is, yes, our trash tonnage has gone down. Our cost has gone down, even though the disposal price per ton has gone up.
Right. Mm-hmm.
Alex might know off the top of her head kind of how much that is, but maybe not. I won't put her on the spot.
It's okay.
But one of the pieces that kind of might damper that a little bit is we did have a free disposal at the transfer station for trash for many, many months to support our residents who were working from home with their students, with their kids, and had extra trash. We didn't want to have to put that financial burden on them. So we put that roll off over at the transfer station to support them with their excess trash. So it's hard to know if that is why we saw a reduction in our tonnage, or if really the trash barrels made that much of an impact. And my guess is it's a combination of both. But to what extent, I don't know.
No, that's okay. I think that the programming that putting in there to help and support families that during this pandemic in terms of additional trash that they might have, I think makes sense given the time that we're in. So I appreciate that was included in there.
Is the extra disposal still out there, and how much it's gone now? Okay.
Yeah.
All right.
Yeah.
So we should be able to, in the next year, be able to really see what it looks like, hopefully.
Yeah, and the complaints in terms of the amount of trash allowed have really dissipated. I don't think we get any of them. People have kind of, you know, adapted to the new system and the new routine, which we expected. There's always a bump when things are changing. And I haven't looked at the numbers specifically, but and Liz would be really great. I can have Liz come to our next meeting and give a little rundown, but I haven't seen a huge increase in our green bag sales to compensate for the loss in tonnage, right? So it's not like we took it away from their barrels and everyone is just throwing away the same amount of trash, but just buying the green bags. So the tonnage that we have lost is not just getting in our trash barrels, are not just getting put in green bags. And I think part of that was because we approached this with a multi-pronged approach, right? We reduced the trash barrel, we did education around recycling, we added composting bins available to our community at like a 75% off. Liz went out to do composting education to individual houses that needed it, as well as group community composting events at the library. So it wasn't just like, hey, we took away your trash. It was, here's other things you can do to support our town and the environment, really, because, you know, they see the dollars. We also see a much bigger picture of reduce, reuse, the reuse piece too. So I can have Liz do a quick year and recap for you guys, because it is interesting. And what, you know, it's not on the agenda, but one of the things we're currently in the process of doing is we put out a new RFP for our trash hauler. That RFP, the last time we went out for an RFP, we did it a little too close. It was like a 7-month window to when we wanted them to take over. And one of the things that did is it created an astronomical price for, they're always going to roll in the cost of new equipment, but they also needed to put in the price of rental equipment until, you know, it takes about a year for a trash truck to become available. So when we knew we were going to be going out for another RFP, we're even earlier than a year before that contract will go into place. That way we won't incur any rental fees or transitional fees with that process. We're going to see the, you know, the cost of the equipment rolled out through the course of the 5-year, 3-year contract. But it will give us enough time for them to get that equipment, so we don't also look at like $50,000 a month for just the equipment rental. So we did get that out earlier. Liz is the frontline contact for any businesses that are looking to respond to that. And I think Mary has been helpful in really getting that through quickly, given that like it's budget season. And so her and Steve are very busy, but I think they also saw the need, because really we are seeing, are we still tracking the trash complaint calls, Alex? Yeah, good. Thank you. We are seeing just a huge amount of missed trash pickups. You know, for the last 6 weeks, Mondays have been missed. For the last 5 weeks, Tuesdays have been missed. Friday's been pushed. And every time there's a different reason for it. It's a truck breakdown, COVID, or just missed pickup, people calling out sick. It's every week there's a different reason, specifically for that Monday pickup. So one of the things I suggested, if Monday seems to be a big problem, which pushes the whole week back, that we need to look at changing Monday's route and reducing the amount of houses, because these people missing their trash 6 weeks in a row thought they had a new trash schedule. I mean, really, we got calls of people saying, hey, my trash schedule changed. So our community is continuing to feel the burden of some of the challenges that Republic has. So I think this bid process will be welcomed and interesting to see. All right. So
all right. Go ahead.
Okay. The next item, it's me.
Mosquitoes.
So I'd roll right into it.
Yes.
The next one is the mosquito control update. So one of the things that last year we expected, and Christine, I don't know how into arborviruses you are, but I'm going to give you a quick little recap. In the summer of 2019, we saw a dramatic increase in triple E cases. They started much earlier than anticipated and with much higher frequency. Triple E outbreaks occur in cycles of 2 to 3 years. So we had anticipated last year to be another one of these large triple E years. I don't know if it was the weather or people weren't outside or whatever, but it wasn't. It broke all kinds of expectations on what we should see after a year like we had in 2019. We are part, Christine, you may not know this, we're part of a mosquito control district. We pay $5,000 every year into this mosquito control district, and they do surveillance within our community in areas that are known breeding grounds. They're anonymous areas, so people don't mess with the traps. We had not even one West Nile virus mosquito last year, which is like unheard of. It's really unheard of. We were like, are the traps working? Like, what is happening? But I don't know. I'm really curious what this year is going to show.
I wonder, I just wonder what the impact of travel being shut down has on the mosquito population. You know what I'm saying? Like,
well,
there's got to be some
birds are
kind
the
of
carriers.
COVID effect, though. I'm telling you, somehow, some way. The decreased pollution, maybe they migrated differently. I don't know, but it's weird, right?
It's weird.
It's also
It's
weird
weird.
because so many people were spending so much more time outside. I know professionally at work, we were like, oh, last year we were like, don't go outside after dusk. And this year we were like, go outside, everybody outside,
Everybody
outside all the
outside.
time.
It really makes no sense. So this season's going to be super interesting to watch, to see what happens, if it rebounds or it'll be,
If
or
you're
not.
fascinated by such things, you'll be on the edge of your seat. Because
Geeking out.
I know I am. So
Dr. Brown would be so proud of you right now.
I love Dr. Brown. If she was proud of me for anything, my life would be complete. So we are continuing our surveillance efforts this year. And also, you may or may not know this, we have catch basin treatments by a local company to treat some of the more heavily used extracurricular areas in our town to keep the mosquito load low. We use 90-day pellets. They come out when they're doing the school areas. They do it on the weekends, so there's not a lot of people there, even though there's nothing harmful for anybody to worry about. They're going into catch basins. And then they'll do it again 90 days later, which gets us through the fall Triple E season. So Triple E usually emerges much later in the year. So one of the things we want to make sure we're doing when we're doing the catch basin treatments is doing that last treatment in a time frame that will keep us protected through the end of that mosquito season. So we've coordinated that. They should be starting any day now. We do hope next year to move to the mosquito control district for both our surveillance and our treatment. We are one of the only areas, so I'm one of the commissioners on the mosquito control district for Pioneer Valley. Pioneer Valley was the only geographic area until 3 years ago that didn't have access to a mosquito control district, because the limitations of each district is defined by whatever the statutory authority is for their creation, and they couldn't go outside of that zone to treat communities that even wanted to be treated. So we are slowly ramping up this mosquito control district in hopes that they will be a full service operation in the years to come. So we'll be able to support that process. We know mosquitoes don't, there are no boundaries for mosquitoes. So the more affordable we can make it, and the, even if it's just surveillance. So a lot of times, our community isn't one of these communities, but a lot of times people don't want to be in a mosquito control district because they're afraid they're going to start spraying adulticide everywhere, or hurting the bees, the pollinators, right? So it's the way our mosquito control district is set up is that it's a fee for service. So if you just want surveillance, you just want to know if there's West Nile Triple E in your community, you can just get the surveillance. If you want more robust treatments like our community does, we use the spray. And when it wasn't an easy transition, you guys were not on the board at that time, but the transition to no longer aerial spraying every April was hard for people to understand why we would stop something like that. So the education really there, in case anyone's watching and doesn't know, is that it was ineffective. At that point, we're seeing the nuisance mosquitoes, not virus carrying mosquitoes. And it really would depend on where we were in the foliage, and it was just far too early to be treating. And it was a very costly endeavor for the town. So we have moved to surveillance and our targeted treatment as a better way to control virus within our community.
Awesome. And we're still able to get our mosquitoes tested up at UMass?
That's ticks.
Ticks. Oh my God. I'm on the wrong bug.
It's still an arbovirus. But they get it from mice, not birds.
Yeah.
Yes, we have.
But that's
still a product.
we still have that going on too.
Well, there is a little caveat with that. Is Dr. Rich has opened a private lab to do that. It is no longer affiliated with UMass for a variety of reasons, but they are honoring our leftover. We had paid them in advance of the use, but yes, that is still an option. It's still tick report. The website is everything's the same. It's just not associated with UMass.
And with
But
And
so
just
is
as a
there a
reminder-
cost? Is there a
There is a nominal cost. We cover like 70% of the price.
okay. All right. Thank you.
And just as a reminder, if you get a tick on you, do not throw it in the toilet. Save it for if you are to show signs of illness, you'll be able to help your doctor understand what you were exposed to. The initial instinct is to, get rid of it in the safest way possible, but throw that thing in a baggie, put it on.
I put it on a
Your
piece of
fridge.
tape. I like to put it on a piece of tape first. It just makes it easier to see it and move it if need be, and then in a baggie. Yep.
Yeah.
And date it. If you have one of those baggies that you can write on or whatever, date it so you know when the tick was caught.
Yeah.
Lots of tick grabbing in schools. It's a thing.
Yeah, we did a toll tick presentation at Tick and Mosquitoes at Pine Knoll, the camp. It was so great. The students, the campers loved it. They were so engaged in the information we were sharing, and had lots of great questions. It was one of my favorite presentations that we've done at the health department so far, because kids are just amazing in their perception of these things.
It's a great idea after 16 years at a camp. I mean, it's integrated generally into a good camp. It's integrated into your day to do tick checks. But if you can get the kids engaged and knowing what they're looking for, then it goes a lot faster and better. And we find more.
So
Anywho.
that is our arborvirus update, because it is that time of year.
Great.
All right. So a quick COVID-19 update. Our clinics are over. We have one last second dose clinic scheduled for next Thursday. And I don't think it's very many people. Alex, what are we looking at? 20? 20.
Yeah, 20.
20 people. It was the end of some extras that we had from the state divided their allotments in different ways, and public housing had their own kind of like funnel, and we got 200 for our public housing, and there were some leftover that we were allowed to reallocate back to the community. So that's why it's such a small number. But after that, as far as I know, we will be done. We were designated a red community 2 weeks ago. We did. I don't know what happened. The cases were not linked to each other. It wasn't a major family cluster. It was just we started getting cases. I was seeing 2 a day, and then it jumped to like 10 a day. Like we saw a significant increase. Thankfully, those numbers have now gone back down to pre-surge numbers. I have the tracking data here. We are looking at only so far in this month about 90 cases, which I think is, since I've been tracking, I'm just scanning over, that's the lowest we've hit since October of last year. That's pretty significant. What I did do is, so our biggest number graphic was previously the 20 to 50 age range. And I chose that because the state was using that for a period of time. But I wanted to kind of, when schools were going back into session, I wanted to kind of see where that was falling. Are these the college students and restaurant workers demographic, or is this the parent demographic? Because if it was the parent demographic, it was going to make an impact on our movement to full in-person learning. So I wanted to kind of track that separately. So after a month of tracking that separately, we see that parent demographic as the highest infected rates that are in our community. So, and by high, I mean, it's 30. So it's not, 30 out of 90. So that's a third of our cases are in that parent grouping. And then the pediatric grouping and then the 51 plus grouping are tied. So they're both like about 20 for the month. So we'll see what happens in the coming weeks post the April vacation. I do expect to see a little bit of an uptick in that, which is a little bit of a bad timing given that everyone is going back into full in-person learning now. But I'm just going to keep an eye on it, and the school and I have, and the rec department and I, in terms of sports, are in frequent communication. I really, I just had to fill out a annual self-evaluation for Mary, and get to say, what one of the good things that's happened in the last year. And in a pandemic, there's not really many good things that I could say, but actually the level of collaboration that the health department has now developed with other departments in town that never existed before. I mean, we all, Christine, you're kind of newer, but before us, there was a elected board of selectmen who were responsible for all of the public health programming in town, and someone in my position working 10 hours a week. So us coming onto the scene as a board, an official board of health, independent of our board of selectmen and elected officials, and a full-time health director with also staff to support the health director, it was a transition. People weren't really sure where public health fit in what they were already doing, right? Like the planning and the master plan. Where does public health fit into this? Was a question that sometimes I had to make a point to show where public health fit. But since this has started, my collaboration with the library, the COA, the rec and schools has, multiplied tenfold. And I think that will, fire department. I mean, it's endless, but I think that will continue post-pandemic and be a real benefit to our residents and allow our work to have greater reach within the community. So that is another great unintended consequence of such a horrible part of our experience the last year. So the schools and I are working really closely. We have very little in-school transmission because we are so quick, and parents are a part of that. Parents let us know immediately, for the most part, when their kid is either sick or exposed or their family member is sick, and it's really allowed us to keep transmission in our schools really low.
So I just have a few questions, mostly just so everybody else hears it too, but are the East Long Meadow schools participating in the state's pool testing?
No.
Okay. Are they participating in the Binex Now for symptomatic testing?
No.
So they're not doing any in-school testing. Okay. And where are we at? There was new guidance released last week. And in addition, it was announced today that high school will be going back mid-May. So the guidance last week around the difference in quarantining for the 3 feet versus the 6 feet, I just, if you could just take a moment to explain to folks where we are with that.
Sure. So last week, DESE announced that within classes in school buses, if you were considered that you were only considered a close contact and needed to be, no, you're right. Okay, so they didn't change the definition of close contact. They had changed the action to what happens if you are a close contact. And they made that very clear. So thank you, Karen. DESE has made so many little things, little nuanced adjustments that keep us on our toes, that's for sure. So what that meant is everywhere else, if you're within 6 feet of a confirmed positive case who is in their contagious period, you need to quarantine. DESE is saying if your exposure happens in the classroom or on the bus, you only need to quarantine if you are within a 3 feet radius of that person for 15 minutes or more.
Or you're not masked, no matter what the, right. The 6 feet,
yeah, so
if you're not masked.
Yes, thank you. We don't really have that. I mean, some of our special ed classes are masked, but for the most part, all of our full classrooms are masks are used. So The school health committee, which includes myself, the school physician, the nursing director, and the superintendent, met after this announcement was made. And as a group, we decided for at least the next month, we are going to continue to operate under DPH and CDC guidelines, which state which continue to quarantine individuals within that 6-foot radius. We are going to track. So what I've asked them to do, that we now have a COVID coordinator at the schools. So what I've asked her to do is every time we have a positive is to graph out the 3 feet contacts in one color, the 6 feet contacts in another color, and then X over anyone who tests positive from that exposure. That way we'll have some real concrete data for May, well, probably end of May at this point, to show 0 people in that 6-foot radius tested positive after their quarantine. So we have a lot more confidence going down to that 3 feet radius. If we see still numbers in that 6-foot radius popping as positive after their exposure, I imagine the health committee will recommend continuing with the 6-foot separation. That's a lot to digest if you're not in Karen's world. Is there?
But I just thought it was important for all the parents and the school staff out there to kind of understand the thinking and your reasoning and what was going on.
I agree. And I think that is really important for us to understand the interpretation and how we're applying sort of some of these guidelines and things that are constantly changing over time. So yeah, I agree. I think that's an important a clarification to make.
Yeah, so hopefully at our next meeting, it won't be the end of our month of collecting that data, but hopefully we'll have some good information I can share with you on how effective just quarantining that 3-foot zone is. It also gets really tricky. So if parents are watching, Karen, I'm just gonna do one more piece here, because if parents are watching, it's important to note. So an example is sometimes schools, and I don't know if our school does, but this was the example they used, have debate classes where it's part of your schedule and you go to class and you do debating. But some schools just have debate clubs where after school for an hour or two, you go to your club and you do your debating thing. Now, if your exposure occurs in your debate class, it's a 3-foot radius for your quarantine. If it happens in your debate club, which is an after-school activity, you go back to that 6-foot separation. So Desi, like I said, has made this really exciting for us. So parents may be confused when they get a call that says, you know, your kid was within 6 feet, and not understanding why that difference might exist. So it's only for classrooms and school buses.
And the rationale being that the classroom and or school bus setting generally tend to be more well controlled and operating under a seating chart, which makes things a lot easier to track. Whereas your after school activities tend to be less supervised and do not generally use a seating chart, although they should. So that's the rationale given by DSE.
Sarah or Christine, any questions on that? That might be a new information for you.
No, living in this world every day.
Yeah. Okay. So then the last, there is one more item. It wasn't on the agenda, Karen, so I'm just gonna jump right into it. Is I found out today something really interesting. So I learned about a vaccine hesitancy group that's working at a Boston Children's Hospital that are giving talks to communities where to address hesitancy in groups, 15 to 18, to talk to parents and review some of that information. I reached out to Boston Children's Hospital to see if they would be interested in doing one for our community. And as part of that plea, I asked the nursing director for our community for the flu vaccination rate numbers pre when they thought it was going to be required. I assumed to some extent any vaccine hesitancy around the flu for that age population would transfer over to COVID vaccination hesitancy. It won't be exact, but just some level of information that would maybe help them feel interested. And Karen, you might have known this where we're at, but so in the age group of 15 to 18, there are 685 students in our community in that age group. 79 of them received a flu vaccine. So I feel pretty confident that there will also be some vaccine hesitancy around the COVID vaccine. I have the person running the Boston Children's Hospital program responded back to me, wondered how many people might be interested. I don't really have that number, but if there was kind of a cutoff, I could advertise it and see if we met that cutoff. So I'm still in negotiations with her. This program that I'm trying to set up has been approved and signed off on by Gordon, the superintendent. So he's on board. If it is approved and they're coming, I'm going to work with the library and the rec department, because each of those groups have their own kind of like followers that may get the information or feel more inclined to participate if they're getting it from their people. So that is something new and evolving that I'm really excited about. I was hoping they could do vaccine hesitancy for everybody, but you know, it's Boston Children's Hospital, so they're going to focus on the pediatrics. But if it's successful, there are other groups that can do it for the adult population.
Amy, I'm pretty sure you can get the vaccine ambassador program to come in. I don't think it's just for the 20. The 20 high risk communities.
Oh, really? I thought
I
it was
can
just
I can double check, but yeah, I'll double check.
Okay.
Because
Yeah,
that's targeted to adults, and they'll speak to all kinds of different groups. Yeah.
Yeah, I maybe I misunderstood.
Yeah, I'll find out.
Okay. I think our community would benefit from that. I'm not sure who would come, but I think seeing the numbers in just that demographic and the parents who are making that decision, we can then assume they're also maybe not getting the vaccine. So hopefully that will help some of our community members either feel more confident in their decision to not vaccinate or vaccinate.
And
Awesome.
that data that you got, that was from this year, Amy? Because this
So
year,
this year it's different because for a very long time, it was expected that the flu vaccine was going to be a required vaccine for participation in in-person learning. So I asked for the numbers for last year. This year's numbers increased to 168 out of 685. So still, considering that was supposed to be a required vaccine, we only saw an increase, doubled about.
Oh, wait. So when you gave that number, I thought that was the percentage. It was the
No.
actual number?
Correct.
See, you had me cheering because I'm thinking 80%. Yahoo!
Oh, no, that is the number.
Holy guacamole, that's terrible.
Well, that's why I was trying to get Boston Children's Hospital here.
Good gravy. And it didn't really go up that much at all. Considering, and I mean, we came in late with the, oh no, you don't need to after all announcement. So
yeah.
Wow.
That's just looking at 15 to 18. I mean, this is a really small sample size.
Yeah, and I think I don't know what the problem was before now. Well, before this year, it wasn't mandatory, and it's tough to get that flu vaccine in that age group in particular, because you know what? Now they know their mind. And I went through this as a parent. And if your 16-year-old says, I do not want an injection, you can't force it upon them like you can when they're younger. You have to give them that bodily autonomy. So I totally get that, but the not getting it, I'm hopeful it's just because East Long Meadow was still really fully remote for much longer than a lot of other districts. And even though we clearly said it doesn't matter if you're remote or not, you still have to get it, the kind of incentive when you're not, having to go in the school building anyway isn't really there. So
yeah, I mean, but we only increased with the requirement. We increased from 79 to 160.
I know it's terrible. It's terrible.
and I think since there was a lot of, at least a lot, probably just because being in the public health field, a lot of education and information around that just in general. So in addition that it was a requirement for school. I was curious, Amy, in terms of the program that you just mentioned, when they come in to do that kind of work, do they ever work with a group of students who continue, like it's almost like train the trainer. I'm just curious to know if for that age group, you know, are there students already in the school? Because I know that in middle school, there was a program that Bay State had done with the middle school with their, I'm so sorry. I just got a tickle in my throat. When the students did some public service announcement. And they did that probably, and that was in the middle school. So for this older age group, are there students already doing anything health related?
Like a health ambassador or something?
Something that I'm just wondering in terms of being effective and engaging that same age group as being the ones who are disseminating that information even beyond that one time. So it's not anything to set up. I'm just curious to know whether that's an element or component that's part of that work. Because once they're gone, the information is gone unless it is something that they leave materials that we can continue to promote, that maybe students who are interested, because I know that there's a group at the East Long Meadow Public School that are interested either to go into health professions or something like that. So I don't know if maybe that group would be interested in continuing to inform other students around the importance.
So in my request out to Boston Children's Hospital, I asked them for kind of like a bullet point thoughts on what they do present. Because if it's something really overtly, you know, you must get vaccinated, it's not going to work in our community, and I would find it somewhere else. So I wanted to make sure that their presentation was one that was going to be well received in our community and not backfire. And so one of the things I can ask them is, do they leave any, I mean, they're not going to come in person, right? Because they're going to do everything virtually. But is there a way they can send us some of that information? And I can take on, you know, asking Gordon and Frank if I could meet with students who might be interested as being health ambassadors to help educate their peers around the importance of this. I mean, I'm happy to take that on. I don't think Boston Children's will directly do it, but
If I can jump, there's no chat feature, so I have a link that I could give you, but I can email it to you. So Boston Children's is probably not going to give you any material for free. That's been my experience, just saying.
but we
However,
have $9,000 of COVID money.
yeah, oh, that might do it. Anyway, all of the school nurse leaders in Massachusetts received a training on vaccine confidence in the fall, right around when we were dealing with the influenza vaccine. And the slides are available on the BU Shield website, and they are for anyone to use. And the vaccine confidence training that they got uses principles of motivational interviewing, and it's all based on evidence and research. And it's excellent. It is excellent, and it will actually work very well, I think, even for the 15 to 18 age range, because they respond to data and motivational interviewing techniques very well. So I think that this is something, I believe Kelly was there, that Kelly and her staff could be using to do this kind of work in the community for anybody, whether in that age range or adults. And I will send you the link to that training. It's available. The slides are available. They can download them. They can use them. And
Yeah,
I just told on them, but so don't tell them that you heard it from me. Tell them it was Christine.
I was actually going to offer, Amy, I do health education with college students as a full-time job. And so if there's a way that I can assist you in this process, I'd be more than happy. And also for anybody out there who is listening, if anyone is vaccine hesitant or not thinking about it, but they're thinking it's so hard to get a vaccine, it's not anymore. It's so easy. I talked to students, adults, 18 to 24-year-olds yesterday who said, oh, I went online to CVS and I got one today. It's that easy right now. And so if anybody is thinking, I don't want to do this because it's hard, it's not hard anymore. So CVS, Walgreens, and our other local pharmacies being a great resource, and just, look, and if it's nothing that's convenient for you, look for the next day, because there's so much out there now.
Yep. And the
Yeah.
Eastfield Mall's going to lighten up because a regional site just opened at the Big E and another one's opening in Chicopee. So all of those folks now have these other big vaccine sites to go to. So yeah, I totally second that emotion. My 19-year-old just came home from went right on, got an appointment at CVS, drove home from college and got it. It was that easy.
Yes.
And I
so-
just sent you the link to those slides, Amy.
Thank you. And for anybody who might be watching, I don't know if people will see this, but if you are homebound, the state has a homebound system that we have enrolled in. So if you need support on getting the vaccine to you, it is, you can call us at 413-525-5400, extension 1103, or you can call 211 directly. It doesn't get you to the front of the line. There is a series of questions they ask you to see if you qualify. And one of the good things about that is it's the one-time dose. So you don't have to coordinate multiple doses. They are using Johnson & Johnson. And while we're talking about Johnson & Johnson, you want to take this? You want me to take it? Anybody want to take it?
I mean, you can, you know the same information the rest of us know. So
Oh, you're the board. People hear me talking all the time. You have an extra level of authority.
go ahead, Amy.
Okay,
You got
so I'll
this
go.
and we'll jump in if need be.
Yeah, so there's going to be supporting documentation to come out from the CDC to address some of the hesitancy around taking the Johnson & Johnson drug. And I'm going to probably oversimplify this, but the health professionals can step in and help me. But the primary reason that there was a pause on the Johnson & Johnson vaccine after 2, which is now I think 6 to total, blood clot is because of the unique type of blood clot we were dealing with. And this type of blood clot, typically blood clots are treated with a drug called heparin. And this type of blood clot can actually cause death if treated with heparin. So they took a timeout so they could educate our providers on what to look for and what treatment methods they need to use if they see that this is the type of blood clot they're looking with, in addition to checking for your blood for certain red blood count, I think. So it was basically, it's small. I think we're now at 8 people, and there are 8 million doses that have been administered in this country. And we have 8 people who have had this problem. So not insignificant, those 8 people clearly have suffered, but it was basically a big timeout so providers could get the information they need on how to properly treat this effect of this vaccine.
But there is additional information that they did release about if you are a woman of childbearing age, you should check in with your doctor about whether you should look for a different kind of vaccine other than J&J. That's just important to note, that one piece. All right.
That is all I have for you guys.
Well, that's certainly enough.
So one of the things I'd like to do before we dismiss, and I know everybody is anxious to probably go live their life because we're all doing work all day long, is to pick a date for us to do our next meeting. That way we could try to get on a more frequent basis, and it's much easier to coordinate that date while we're all together versus via email back and forth. So it seems that Tuesday nights are a good night for people in general.
Yep.
So if we want to look for a Tuesday in May, maybe the 25th.
So I'm always going to be committed the second Tuesday of the month, but the other 3 Tuesdays of the month are good for me.
Okay. So that leaves us the 18th or 25th.
Okay, I have to check, but right now, I have a commitment normally, I just had some backup tonight. On Tuesdays.
Oh, okay.
After school
And
activity.
Karen, you have a Thursday conflict.
Yes, although it's been waffling between Wednesday, Thursday, but I think it's a Thursday conflict. I'm sorry. What can I
All
say?
right. So we'll plan for Wednesday, maybe next month.
Any chance that a Wednesday could work? I'm free at
Yeah.
6.
I could do Wednesday, but if we could push it to 6:30, that would make my life so much better.
I'm good on Wednesday at 6:30.
So 26th?
No, that, oh yeah, Wednesday's the 26th. Okay.
Okay,
Okay, so May 26th at 6:30. Yay, this saves us a lot of back and forth.
thank you.
All right. Anything else,
Most
Amy?
likely will still be virtual. I don't think Mary has any plans to resume in-person board meetings, but if that is something that she, I think we might even still have the option to meet virtually for a little bit, even if she allows Board of Health meetings or boards meetings to meet in person. But if that happens, I'll certainly communicate that with you guys and we can have a discussion on what works best.
Okay, sounds good.
I actually think us meeting virtually allows more people to hear what we're saying, right? Because it ends up going on Facebook and LCAT as a recorded event, and so people can come in. Whereas when we meet in person, I mean, I love seeing all of you, but the message, we don't get a chance to deliver our messages as well.
Definitely. I think the more that people have access to hearing this information, it keeps people much more informed. So that's fine with me, for a little bit of time period, and then we can reassess.
Absolutely. And I think they're seeing that across the Commonwealth, probably across the country, that participation in boards and such, and municipal government in general is way up, probably due to a lot of different things, but certainly the ease of access is one of them. And again, which becomes an equity issue that I'm just going to keep talking about. So, all right. I think now we can make a motion to adjourn.
I second that.
All in favor?
Aye.
All right. Thank you.
All right, guys.
Great
Enjoy
meeting.
the
Good to
rest of
see
your
everyone.
springtime.
Nice to meet you, Sarah.
Very nice to meet you as well. All right, take care.
Bye,
Bye-bye.
everybody.
All right.
Bye.